outbreaks and complex cases. 8 of those are being investigated by our public health team and 2 cases were reclassified. There are no additional fatalities to report today, but of course we send our best wishes and our condolences to all of those families who've lost a loved one at the hands of this global pandemic. There are 21 Victorians in hospital, 1 receiving intensive care and not a ventilated patient. A total of 2,827,761 test results have been received since the beginning of the year, and I'm very pleased to say 16,647 test results since yesterday. Can I thank each and every one of those more than 16,500 Victorians who went and got a test the day before. As you've heard me say many, many times, there's arguably nothing more important than symptomatic Victorians going and getting tested as soon as possible. I know it's nice weather today. I think tomorrow is similar. Please don't put off getting a test until Monday. If you've got symptoms, even very mild symptoms, please come forward today and get tested. You'll get your result tomorrow. And if you are positive, we can protect you, your family and every single family by putting a public health response around you and your loved ones. I know it seems a bit counterintuitive, but what we want is to find this virus wherever it is. And if that means numbers are higher than they'd otherwise be, that'll only be for a point in time. If we find cases, then the numbers will ultimately be much lower than they would be if we don't find them and there is infection on infection and chains of transmission that can move very, very quickly and silently, where we have just a small number of cases in the first instance that can become such a significant outbreak. So there's really, apart from following, of course, all the rules that are relevant to where you are, there's nothing more important than symptomatic Victorians coming forward, getting tested, giving us the certainty and the most complete picture so that we can take the next steps. There are 19 healthcare workers who are active cases. The rolling average to 9 October is Metro 9.5 cases, regional Victoria 0.4. In terms of mystery cases, there are now just 10 of those in the rolling 14-day period to 7 October. They are all in metropolitan Melbourne, none in regional Victoria. In terms of the metro-regional split, one of those 14 cases today is from regional Victoria, from Mitchell Shire, from Kilmore. That brings to a total of 5 the number of active cases in regional Victoria, and they are all in the Mitchell Shire. I do want to also just note that the Mildura case that I think we'd spoken to you in some detail about, but likely to be a low positive or a false positive, or if that has been confirmed, and that person has been taken out of the data. That's one of those reclassifications that I referred to a moment ago. I do want to pay special mention of the Kilmore community and the amazing job that they have done and are doing. There's a total of 724 people in that local community have been tested. We haven't got all of those results back. There's a couple of hundred tests that were done yesterday, but we'll update you on those in a rolling sense. But in a community the size of Kilmore, to have 724 people come forward and get tested, I want to thank each of them personally and thank that community for the way in which they have worked so closely with our public health team. That's been a changing set of circumstances as more and more a more complete picture has become known to us, and the local community has done an amazing job in being as cooperative and being as invested as we need them to be in pulling this up. Brett can speak in more detail about the total number of cases that are connected to that outbreak from Chadstone all the way through to Kilmore when he speaks to you in a moment. I did want to just quickly update you on the number of active cases in aged care, 42. So that number continues to fall. That's very important given the vulnerability of those settings. And by way of thanking all of our health team, and health services are delivered by teams of people. Some are clinical staff, some are not. We thank each and every one of them for the amazing work they do in every setting, every shift, every single day. We're so grateful to them for the work that they do. And I can confirm that the number of shifts that have been worked by hospital staff in private aged care facilities, so people leaving their normal job to go and do some of the most challenging work that they've perhaps ever seen in private aged care, is now 4,866 shifts that have been worked, and on behalf of all Victorians, and particularly those who've got loved ones in Commonwealth-funded and regulated private aged care, I want to thank each or every one of those staff members. That's a really very, very impressive thing. Nearly 5,000 shifts, that is a very impressive thing. Now, Martin is going to speak to a couple of issues, and so will Brett. But before then, can I just offer a couple of insights on where we find ourselves? With the metro average at 9.5, that is, and 14 cases today, that is certainly an infinitely better position than we were in not that many weeks ago when we were reporting 725 cases. We have seen great stability come to these numbers. The tail of this second wave was always going to be stubborn, and that's exactly the way it's panning out. I think it unlikely that we'll be able to move as fast as we would like to have done next Sunday. So I think it's unlikely that we'll be able to take as big a steps as we might have hoped to take next Sunday. But I do want to confirm for all Melburnians, and indeed all Victorians, we will take steps next Sunday. And Martin, Brett, myself and other colleagues will spend an enormous amount of time this weekend and throughout the week determining exactly what those next steps can be. We've all come a very long way, and the last thing that I will sign off on is doing what might be popular and what might perhaps please some, but actions, steps that are not safe, that will set us back, that will see all that has been given by Victorians across our state frittered away and count for nothing. We are very close to being able to take big steps to find that COVID normal and to lock that COVID normal in, to draw a line under 2020 and look to a much better 2021. You can't cheat this thing though. You can't ignore it to the point where you let your frustration get the better of you. And I understand and appreciate there is significant frustration out there. All of us want to be connected to family and friends. All of us want to get back to work. Businesses, not just for profits, but for their people, they want to be open. For their customers, for their staff, for the communities that they're an important part of. So whilst I think it is unlikely that we can take as big a step next Sunday as we had hoped, there will be steps taken. So there's no need, and it is in no way warranted for people to be despondent or for people to lose any sense of hope. This strategy is working, but you've got to do it properly. We can't have a situation where, because we want it to be over, we pretend that it is. That because we want to have defeated the second wave, we pretend we have, when in fact we haven't. We're very close, but we haven't quite achieved that yet. Now, we'll monitor these numbers as they come through all throughout this week. We'll also look at the narrative, the stories that sit behind each of these cases, and whether it be mystery cases or cases that are connected to very well managed, very well contained outbreaks. All of that, all the stories that sit behind those numbers will be an important part of the thinking and the decision making that we do this week. We always want these numbers lower, faster. We've just got to be as stubborn as this virus. That's what we have to do. We have got to see this through, to stay the course, to get these numbers low, and then we can keep them low. But there will be steps next Sunday, and they'll be as broad and as significant as they can possibly be, but they have to be safe. If they're not safe, then we will throw away everything that Victorians have built. I think that the contribution that Victorians have made is a point of pride for our state. And it is a point of pride for me to lead a state that whilst we've stayed apart, we have absolutely stuck together. And that's how you drive these numbers down. That is how you look out for each other. That's the Victorian way. We will beat this second wave, but we've got to do it properly. There's no shortcuts here. Otherwise, we'll have literally 5 minutes of sunshine and we'll be pinballing back and forth in and out of restrictions all summer and all 2021. I don't want that. No one wants that. So, I know it's frustrating. Everyone would like me to make all the announcements for next Sunday now, and I'd like to as well. But we're not in a position to do that. We have to wait and see the data as it comes in each day this week, particularly with a focus on those mystery cases, and those numbers are coming down. as well as the point I made around narrative and the story that sits behind each and every one of those cases. Before I ask Martin just to add to my comments, again, I know I say this a lot, and I'm going to say it again. I just want to thank personally every single one of the 16,647 people whose test results came back today, which means they got tested yesterday and late the day before that. It's a small thing, but it makes a massive difference. It's a small moment in time, but it is an enormous contribution by those nearly 16,500 people. It is such a big and meaningful thing. So if there's even just the one thing you take out of today's briefing, or any of the many briefings that we've done over these last months, it's this. If you've got symptoms today, however mild, please don't wait till Monday to get tested. Please go and get tested today, because that will help us drive these numbers down even further and take those safe and steady steps in the weeks and months ahead to lock in a COVID normal for summer and for 2021. I'll now ask Martin to speak to a couple of important matters, particularly in relation to wastewater testing and some other testing updates. Then Brett can speak to the numbers of the day, and then of course we're happy to take any and all questions you have.
Thanks, Premier. I wanted to address two matters today. Firstly, to expand on the important role of testing and some announcements in the regions for more wastewater testing, go through some of the numbers at both Kilmore and Chadstone, and secondly, to just mark today as World Mental Health Day and the impact that the global pandemic is having on the mental health, not just of the Victorian community, the Australian community, but indeed the globe. So first things first, testing takes many forms, and we're here today to announce the expansion of the wastewater testing program, particularly in regional Victoria, knowing how important that has been to give communities confidence that they can safely go about their business of reopening. So Victoria will increase its wastewater testing surveillance program for viral fragments of coronavirus from Monday for a further 10 regional sites, bringing that to 40 sites across Victoria. And those 10 sites that will commence sampling as of next week are Bacchus Marsh, Gisborne, Melton, Portland, Warrnambool, Hamilton, Horsham, Cowes, Bairnsdale and Kilmore. And that's very important because, as we found in the Surf Coast areas in recent times, whilst we do find fragments from time to time through that wastewater program, that gives communities an early indication of getting out there and getting tested. In both of those communities, that program has indicated that whilst there has been fragments of the coronavirus in their wastewater, the extensive public testing that then followed that early advice has shown that there hadn't been any active cases in that community. So we want to make sure that as we expand this program to more sites across regional Victoria, and indeed in Melbourne Metro, where it's been underway, that gives the community the assurance that in addition to the tens of thousands of Victorians every week who get the nasal swab and increasingly other forms of testing, that we've got the testing areas covered. As we have said many times, there is nothing more important than you can do if you've got any early signs of the virus is to get tested, however mild those symptoms might be. This wastewater testing is part of the other armoury that the public health units bring to reassuring Victorians that the safe, careful reopening of Victoria as we deal with the tail end of this second wave can make sure that we've all got confidence to reopen. The second aspect of testing that I wanted to deal with was just to add to the Premier's comments around the outstanding efforts that both the Kilmore and those involved in the Chadstone clusters have been dealing with. As the Premier indicated, We've seen some 724 tests in Kilmore this week. Yesterday, a further 120. And that's been an outstanding effort by that community. The two sites, both at the Kilmore Hospital and the pop-up site in town at the Memorial Hall, are open again today and over the weekend, and we would encourage anyone who has even the mildest symptoms to go and get tested, and indeed in Kilmore, the wider testing that's underway as a result of close contacts and contacts of contacts. So in regards to Chadstone, we've now seen some 2,634 tests associated with the two sites there. Yesterday that was a further 332 tests in those locations, and that equates to, of those numbers, some 70% of the staff of the Chadstone various retail and other outlets have been tested, and that also is an outstanding contribution that they've made to making sure that we haul that cluster back and give the communities of the south and southeast the confidence that Chadstone will remain a safe place to visit. I'll move on to mental health and mark today as World Mental Health Day. We know that as a result of the global pandemic that we've seen increases in mental health issues, in fact, not just across Victoria, but right across Australia and indeed the world. So today's World Mental Health Day is a particularly important one to send the message that help is always available. Support is always there and increasingly is there as a result of the now more than $220 million of new funding that the Victorian Government has brought to our frontline, our clinical and our community mental health support services right across the state and right across all the specialist and diverse mental health providers that we have supported in our state. In previous opportunities I've had to update data on how some of the mental health presentations are going in some of our more acute settings. We've seen that data bounce around a bit over the course of the pandemic. I just wanted to take the opportunity to update the community on some of those figures. So the data as of the most recent cut of that from about a week ago is that we've seen a 5.7% increase in intentional self-harm and suicide ideation presentations in our emergency departments. This has come down substantially from the peak of the second wave and is in line with areas that we saw earlier in the first wave. Any increase in presentations is significant, but the fact that it's now a 5.7% increase for the same period in last year is a significant improvement as to where we were some time ago in the pandemic. For young people, that category of presentations, as it has been throughout the pandemic, is still substantially higher, lower than what it was, but for the period for people under 17 years of age, we've seen a 31% increase for presentations compared to the same period last year. Overall, mental health presentations in our emergency department are now at, across all age groups, the same level as what they were last year. And we also saw the most recent monthly data from the coroner's report dealing with suicides. All suicides are tragics. Any suicide has ripple effects right across our community, and the numbers are still way too high. But as the coroner's monthly report has indicated, they are remaining at very similar levels to what they were last year. The important work that we have undertaken in the Royal Commission into Victoria's mental health system is very, very important to making sure that as we come out of this global pandemic and all of its implications on our health and well-being as a community, that the opportunities it presents to completely reimagine and rebuild our mental health system as an important part of recovery is a really significant opportunity for us. We know that whether you're experiencing mental health conditions and challenges for the first time in your life as a result of the global pandemic, or as the 1 in 5 of us who will, in normal circumstances in any year, seek support for mental health issues, that support is now there more than ever. And the first thing I would say is you can always reach out to the support that all levels of government bring to Lifeline, Beyond Blue, and a whole host of other emergency and specialist frontline mental health organisations. It's always there. Increasingly, the hope is there for a better remainder of 2020 and a much better 2021 as we go about bringing to an end this second wave. So I would urge anyone who is feeling challenges with their mental health and wellbeing to call either Lifeline on 131144 or Beyond Blue on 1300 22 4636. And I would also urge any other number of specialist programs that are out there for particularly young people with eating disorders, for parents with particularly young mums and first-time mums with postnatal depression, specialist groups in our culturally and linguistically diverse communities, our LGBTIQ communities. There are specialist providers that the Victorian Government has brought record amounts of support to over the course of 2020 and the pandemic's response to keep you safe and well. Support is always out there, hope is always out there, and as we bring to an end this second wave of infections, the support and the hope is getting better and stronger all the time. So I'll just end my initial comments there and hand over to Brett to talk about the numbers of the day in more detail. Thanks very much.
Thank you, Minister. So again, a day driven largely by community-based outbreaks. The Box Hill Hospital case is now number 10. There are 5 new cases from one family being added today. So the outbreak comprises, 3 staff, 1 patient, and now 6 household contacts. But all cases are isolated. All close contacts of the Box Hill staff are quarantined. This is how you stop a cluster from expanding. All staff on the COVID ward have been asked to seek testing and isolate pending those results, and non-close contact staff can return once they obtain a negative result. They're still looking into the potential source of that outbreak, but all potential avenues are being explored. The Kilmore cafe now has 6 linked cases. I think I spoke to the 6th case yesterday, so a diner at the cafe on the 3rd of October. So that now refers to the case, a close contact who dined there, 2 staff who were present at that time, household contact of one of those staff members, and now another diner. But again, the way to end these clusters is doing exactly what Kilmore is doing. So to have over 700 people test, to have close to 300 people in quarantine as full households, that contacts of contacts, all quarantining until some negative results come through for the first ring of contacts. That's exactly how this cluster will end. And I'm sure in a week or two's time, we'll be talking about Kilmore having no further cases, and in a couple of weeks' time, hopefully, no active cases whatsoever. So the strategy for these community outbreaks is exactly what's happening in the response to Chadstone, Box Hill and Kilmore. In Chadstone, there have been thousands and thousands of people who've come forward for testing, so not just the 70% of staff who were present at the time of active cases in that outbreak, but thousands of other people who moved through and who were casual contacts who might be identified as positive. Again, if you have a particularly infectious person, if you're unlucky, then even as a casual contact you can pick up this virus. So it's a really important extra step that the attendees of Chadstone are taking to get on top of this, but no new cases linked to that outbreak as of today, and so I think we're on the tail end of that cluster. Thank you.
We are happy to take any questions you have.
Premier, in Graham Ashton's closing statement to the inquiry yesterday, it lays the blame for hiring security at the feet of your private office, the Department of Premier and Cabinet, and the Department of Jobs. Do you accept that?
No, I don't, nor do I accept that it's the province of the former Chief Commissioner to be settling these matters. He's made a submission, Victoria Police have made a submission, there have been many submissions. It's for the independent board to determine what findings they make, what's included in the report that they'll hand down in just a few weeks.
In the 6-minute window, though, from where Graham Ashton went from understanding police would guard hotels to when private security would be used, a text message was sent from someone in your private office to the Department of Premier and Cabinet which referred to security. Who sent that message?
These matters have been canvassed in some length and detail at the hotel quarantine inquiry. The board will look at all of these matters.
But clearly this shows your office was aware of security arrangements given that...
No, that shows no such thing. You should perhaps read those texts. You should acquaint yourself with the details of that. That shows no such thing whatsoever. There are
that text?
Again, these matters have been and are still actively under the consideration of an independent board of inquiry. I'm not going to do the work of the inquiry for them. They're set up to do this work, and I'm confident that they are being as diligent, as thorough as everyone would expect them to be. They'll have a report which they will hand down in just a few weeks' time, and they will make findings. They are free to do that. They are obliged to come back with a series of findings and whatever suggestions, whatever recommendations they deem appropriate. That matter and all of these matters have been canvassed. We are essentially at the service of that inquiry. If they need any further information from me or anybody in the government, then they only need ask. I went to these matters in some detail yesterday, and I really have nothing to add to the answer, because the answer essentially is this. We need to wait to let the board do their work. We need to wait and read the report. They are the ones that have poured over 300,000 pages. They are the ones who have heard evidence from many, many witnesses. They are the ones who are appropriately charged under an Act of the Victorian Parliament with coming back with answers, conclusions and recommendations for the future.
But
Premier, would you like to find out who made...
wouldn't
Premier,
it be
would
better
you
not
like
to
to
wait?
find out who made the call to hire private security?
Sorry?
Would you like to find out who made the call to hire private security?
Well, we'd like answers to many questions, and that's why the inquiry's been set up. And the terms of reference, I think, go to that very, very clearly.
So
To Grant's question, it's not a matter of whether I like to wait for the final report. There's no choice but to wait for the final report. You don't set up a process and then second-guess that process. You don't set up a process and then run your own process. That doesn't make any sense. This is independent, arm's length, under the Inquiries Act of the Parliament. Evidence is given on oath, statements are handed up on oath, and it's appropriate that we let the Board of Inquiry do their important work. And given the breadth of documentation, the amount of witnesses, the amount of material that they have looked at and are looking at, I don't think it's unreasonable that it does take them a little while to write a report, particularly one that's as important as this.
Apologies, Premier, I didn't get a chance to finish my question,
Sure.
but I mean, would it, in interest of community confidence, would it not be better to not wait to be asked for something like phone records, but to volunteer
I'm
them?
not going to be interfering in the work of that inquiry. If they seek any information, that information or any other information, then they only need to make a request.
But given you yourself said that you
No,
would
they have
like...
not. And if they do, I've been pretty clear about what the answer will
Are
be.
you concerned that they haven't asked for them?
No.
Everyone wants a full-ranging inquiry. Surely
Well,
this is absolutely right.
I think it unfair and inaccurate to describe this as anything other than a full-ranging inquiry. It has broad terms of reference. It has a substantial budget. I think it's demonstrated that it has an absolute determination to get to the bottom of what has gone on. But none of us can necessarily answer those questions now because, again, back to the central point, we haven't seen the report. The report's not written yet. The report will be written in a few weeks, and then we'll all be able to review that and have a much more fulsome discussion then.
Premier, given that you said yourself that you would like the answer to who made that call, why wouldn't you and your office just release those phone records of your own volition
because I'm not running the inquiry, and with the greatest of respect, neither is your network. This is being run by an independent you've asked your question, and if I could be permitted to maybe answer it, I'll be more than happy to do that. It is not for me to determine. It is not for, with respect, anyone in this room to determine. There's an independent process, and it's been set up, and it's not concluded yet. It will be, though. It's not.
So why didn't you release the phone records for that period of 6 minutes?
Because I'm not running the inquiry.
What do you have
the
to
inquiry
hide?
want
What
to
do
know.
you and your staff have to hide?
That might as well have been your first question, really, because that's sort of what you've been working up to. You don't set up an inquiry with broad, independent terms of reference if the inference that you've just made is in any way accurate.
I didn't make an inference. I asked a question.
I think you might have. I've set up the inquiry. The inquiry is doing its work, and the inquiry will report in just a few weeks' time, and then we'll be.
For the inquiry, this relates to your private office. So isn't this a
Well,
matter for
I'm
you
terribly
as well?
I'm terribly sorry, but that's simply not right. The inquiry is looking at all of these matters. Again, it is completely wrong for you to put to me that the inquiry is not looking at all of these matters. All of these questions, all of these issues are being considered, have been considered, are being considered, and the inquiry has not finished its work. We really are going around in circles here. It's an independent inquiry. I'm not going to interfere in that inquiry.
The air would be clear.
As I just said a moment ago, we've done a few of these now, and I think they always work best.
Is the reason we're doing a few of these because you're not answering the questions?
Well, no, and the reason that we're having this exchange is because there seems to be some difficulty in, you can ask the question, that's absolutely your job, but please give me the opportunity to answer the question. I don't think that is in any way, that's not an extraordinary thing for me to ask of you. You've asked a few questions, and if I can get a word in, I'll be more than happy. And if I could do it uninterrupted, I think that would be just a better way to go, a much better way to go. This process is independent. This process is not finished, and therefore, inviting me to interfere in that process, that's not going to happen. It is not going to happen. That is my answer, and we can go round and round as many times as we all like, but my answer will not change. I did not set up this inquiry to then run an inquiry myself. I did not set up an arm's length independent inquiry to then be essentially trampling all over it. It's independent. It will seek whatever it wants. It will find whatever it believes is fair and factual, and as they deem fit, whatever recommendations they believe are appropriate. That's the nature of an independent process. This is not a government inquiry into the government. This is an independent process, and it should be allowed to run its course. And everything I've said, everything, for months now, has been consistent. This should be done at arm's length, and it should be allowed to do its work. And that's what I intend to do. And whether that be popular, how that looks, is of no concern to me. It needs to be done properly, and that's exactly what's happening here.
But Premier, surely though it's a matter of credibility.
Well, Nick, you can make your own judgments about those things. I've answered the question as clearly, as frankly as I possibly can. I will not interfere in an independent inquiry that is not yet finished.
So just to finish
I simply won't. That would be inappropriate.
The credibility, the public is now looking, you're about to make, and your government's about to make some very crucial decisions over the next few days. The public have got to look at those decisions, and given what happened yesterday, what appears to be feuding within the government, and certainly the headlines today, can you understand the Victorian people worried about the capability of this government to make those decisions with all this hanging over them?
Well, Nick, let me make something very clear to you. I don't govern this state based on headlines. I never have, and I never will. I'm not elected to be governed by headlines. If I were, and if they were quite as important as some think, well, I don't think I'd be standing here, frankly. I don't think I'd be standing here. So you know, I'll let others do that. That's for others to worry about. What I'm focused on is getting these numbers down, making safe and steady decisions based on public health advice, based on a curious concept for some, science, actually being driven by the epidemiology of this virus and getting the job done. That's what I'm focused on. And this is not a popularity contest, and this is not a political contest. Those matters have never been less important to me. We've got a job to do here. The vast majority of Victorians are doing an amazing job to get to the other side of this. I'm proud of them, I'm grateful to them, and we will continue working as hard as we possibly can every day to defeat this second wave and then open up. As I said earlier, we will not, I don't think, be able to move as far and as fast as we had planned to next Sunday, but there will be movement. It will be significant, but we've got to do things that are safe. We've got to do things that don't set us back, that don't see everything that's been given handed back. This virus is stubborn, and we have to have that same sort of, that steely determination to beat it. As I said earlier on, and as I've said many, many times, just because we all want it to be over, and of course we do, we can't just pretend that it is when the data tells us that it isn't. We'll have more announcements to make, and those announcements will be based on public health advice. They'll be based on a thorough consideration of all of these issues, and the day for those announcements is not today or tomorrow, but indeed next Sunday.
Is it going to be stage 4? Is it going to be excuse me, sorry. Is it going to be stage 4 well into November then, Premier?
No, I wouldn't say that. I wouldn't say that. I think that the current restrictions, there will be easing next weekend. And I know it's frustrating that I can't give you a complete list of all the things that we propose to change in a week's time, but that's not the nature of this virus. The nature of this virus is that we have to get the most complete picture. So we have to get as many days of data as we can so that we're making decisions that, on the best available evidence and advice, are safe and will allow us to keep moving forward rather than risking, giving back everything that we've done. Next Sunday, so 18th, 19th, there'll be some significant announcements, but I'm just being as upfront as I can be. I don't want to be anything other than clear with the Victorian community that based on the daily average, which is a very impressive number when you consider where we were not that long ago, but it is likely not to be low enough for us to do all the things that we had foreshadowed, but we will do some of them and they will be significant. So I think the answer to the question is no, we won't have these sorts of restrictions on well into November. Will there be rules in November? Absolutely there will be. And they'll be safe and they'll be as broad or as they'll be as limited as they can possibly be, based on that whole notion of trying to be as proportional as possible. Highest gain for the lowest public health risk.
While we're on that, can we have an idea of the thought process on how you're going to evaluate which measures do ease up? Are you looking at those stories to work out how transmissions occurred as to what's appropriate? And then, in that case, is outdoor dining something that you'd open up? Because it doesn't look like any of the cases we have, aside from the Kilmore indoors, are occurring that way.
Oh, well, look, Grant, I think it's fair to say that the differences in risk between indoor and outdoor settings have always been front of mind. That's a well-established fact. So, yes, to an extent, that broad principle about inside versus outside will continue to guide us. I know it's very difficult for me to answer your question today. The day for me to answer all of those questions and to go into some detail about why we've made the decisions we've made is indeed in about a week's time, when those decisions have in fact been made. But it'll be thorough. It'll look at not just the numbers, but as we've said a number of times, it will look at the stories that sit behind each of those numbers, so that we can have the most complete picture and not just be guided by the figures, but there is a qualitative element to this. And I think we can be very confident that whether it be Chadstone, Kilmore, or just think back a little bit further, Colac, Latrobe Valley, there's been a number of outbreaks that have been expertly managed. Everyone's working as hard as they can, and we are pulling them up. And that's a function of smaller numbers, obviously, but it's also that continuous improvement, moving from cases and contacts to cases, contacts and their contacts, over these last week or 10 days or so has been a really important part of that.
But obviously businesses and indeed people who have got bookings in regional areas to go away and that need more than a week.
Well, regional Victoria is open. Regional Victoria is open, but people
metro cafes and so on.
Yeah. And I went to this yesterday. It's simply not going to be possible for us to be providing people with a week's notice, because what we want to do is have as much data as we can possibly have, and then make the decision at a point in time based on that data. Where if we can give some notice, as we've been able to do with schools, for instance, we absolutely will do that. But it gets very challenging to be able to forecast with any certainty. That's just the nature of this virus. The tail of this thing is stubborn. We've got to be equal to that. And I know it's frustrating. I know everyone wants those connections. Everybody wants to be back at work. Everyone wants to be back open up in lots of different ways. But if we were to do that without due regard to the advice, without due regard to safety, without due regard for all the sacrifice that's been made over such a long period of time, then that would not be, in my judgment, the right decision to make. However, there will be movement next Sunday. It will be substantial, but I don't believe at this stage it will be the full suite of changes that we had forecast. I'm not pleased about that, but that's just the nature of this virus. You've got to see this thing through. Otherwise, everything that's been given and everything that's been done won't count for much.
Well, can you just detail the settings that the data is currently highlighting as being the most problematic? I don't know if it's a question for Brett, because it seems...
No, we can't do that, I'm afraid. I cannot today sit here and go through, because it doesn't relate to exclusively individual settings. It's not a situation where you, to the extent that many might think, it is not a situation of going through every single setting and making a risk judgment based on those settings. There is a bigger concept here that is about aggregate movement and therefore the aggregate spread. Movement means virus. That's why we have to be very, very careful to get the numbers down low enough that we can allow movement, allow freedom, allow that sense of COVID normality to come to the place. But we've got to be very, very careful. So those nothing in the last 4 weeks has changed what we have always regarded as high-risk workplaces, high-risk behaviour. So, for instance, going and spending time at people's houses in groups, multiple families in the one inside for a period of time, that's always been high risk, and it stays a high risk. I don't want to speculate about the things that we might do next weekend. I just thought it was appropriate today, given that it's 14, people can see that going as far and as fast as we had hoped to do next Sunday was looking less likely. And I've always said, if we're planning for it, or if there's not a formal decision been made, but if we've got a sense of something, then it's only appropriate to share that with people. But as I do that, though, I have to make the point that I can't answer all of those questions now. We will be able to answer them on Sunday, and that's one of the very frustrating parts of this thing.
Epidemiologists have told us for the past week, and maybe it's one for Brett to address, that the 5 kilometre rule on a social level isn't necessarily as effective if we still have essential workers moving about. Does that factor into the medical opinion at all, Brett?
Well, just before Brett, we do have essential workers. The flip side of that argument would be to say that we should have a lockdown that's kind of Israel or Spain or Italy when they were at their very worst, which was no one leaving home, New Zealand even, to the point where literally no one or a tiny, tiny number of people were allowed to go out. That's not what we're doing here. We've got some workers working, and 5 kilometres does limit movement, and it means that a much smaller number of people are potentially taking the virus to other parts of the city, other parts of the state. It's very difficult to attribute in fine detail what the percentage of benefit you can attribute to that particular measure, but I think common sense simply tells you if you're not moving further away from home, then you're seeing less people, you're engaging with less people, and that therefore deals with our risk. On the epidemiology of it, though, I'm more than happy to throw to Brett.
Yeah, certainly we'll look at all of those individual elements and try and tease them apart, looking against the transmission that we've seen occurring over recent weeks. The 5K limit in particular limits the number of households that you can meet outside by virtue of that constraint. But of course, every single decision, every single element that we're looking at has that public health benefit versus the potential psychological or social harms. And so that's also front of mind as we make those considerations, and any changes to those elements, or moving to a different mode. But it's pretty clear that we've got transmission between families, we've got transmission within households, we've got transmission within workplaces that are open. That's where people are meeting, but that's not new, and it really does relate to that aggregate risk. What does the modelling tell you? If you move to another step, what are the risks of it getting away from you? We absolutely do not want to be in a situation in December where this is increasing in number rather than whittling away to nothing.
Do you accept that reaching the penultimate step of this roadmap is now virtually impossible, given we're seeing cases increase again here, we're seeing 10 cases a day in Sydney. It seems cities with 5.5, 6 million people, it's very difficult to record 0 cases, let alone 0 cases over 2 weeks.
I think it's challenging. There's no question it's challenging. I don't think it's impossible. The settings that we're in now and the settings that will be even at the next step won't be as open as applies in New South Wales at the moment. If we had settings like that, it would be extremely challenging and maybe impossible to be able to get to 0 community transmission. But it's not, at this point in time, impossible. I think it's not just the physical distancing measures that will drive the numbers down, it's all of the immediate responses to clusters. And if you can get on top of each of those and you can wrap the public health response around each and every one of those, then you end those chains of transmission and they're gone forever. So the few cases that we see emerging every day, including those cases of unknown source, if we can just contain them, that's the end of that chain of transmission forever. So we need to find them and we need to end them, and that can get you to 0 community transmission. So it's not impossible, and it doesn't mean that it goes down by 1 average every week, every fortnight. You can actually cut it off much more suddenly. We saw in the first wave that it can actually be cut through right at the tail if you can get to every single case. We've got a much more challenging second wave in that regard, but it doesn't make it impossible.
Does the way the latest cases have kind of moved from Frankston to Chadstone to Kilmore undermine or cause more doubt than you had a few weeks ago in terms of achieving that, though? Because clearly that shows a pretty big geographical spread that's exactly what we don't want.
Oh, it certainly clarifies in my mind how substantial that challenge is, both when you've got that essential work and people are being totally compliant, but also when there's non-compliance, how easily it can get away, how easily it can spread geographically. So it absolutely points to the challenge, but we still know that the things that work can work in these cases as for any case that arises.
But if that's happened with these settings, how do we go further? Or does it matter that we've got these settings if it still happens?
Well, I think part of the shift that's happened recently of the context of contacts is getting on top of those cases before they can transmit to household members, who then might go out to other settings and introduce it to other workplaces or regional Victoria for that matter. So cutting it off at that point in time by really going broadly with wrapping the public health response around is one of those interventions, but it also comes through the messaging and the community engagement. Part of what drives numbers now is that a couple of weeks ago we saw that people were too slow to test from the beginning of symptoms, and people were too slow to isolate from the beginning of symptoms. So they're the things that are contributing now to the cases that we're seeing, and we need to turn that around. And so we'll reflect on every single one of those newly emergent challenges. It's been a challenge all along, but it's particularly been a case recently, and I think it's that very tricky challenge as numbers go down that people think, oh, this can't be coronavirus anymore, or the likelihood that I've got it is low, I can still see friends, or it's just my family. This illustrates that that's not the case, and that the messaging has to get stronger than ever, that you isolate as soon as you have symptoms and you get tested as soon as you have symptoms, because that'll turn it around.
So from everything you're saying, obviously you still consider the 5 kilometre rule an important tool. So there's very little chance that will change next week, despite all that.
No, I wouldn't say that. Every single tool that we've considered important at whatever point in time gets re-evaluated through all of the stages that we move through. And so I think it gets evaluated, re-evaluated as for anything else. It's provided its benefit. It has reduced the number of contacts that you can potentially meet, and it's reduced the distance that virus can travel by virtue of that. But it should be up for evaluation as for anything else, to be tweaked, to be dropped, to be strengthened, whatever the case may be.
And the Premier was talking before about the general principle of outdoors being safer than indoors. So does that offer some hope to the hospitality industry for next weekend?
I'm not going
to
to telegraph decisions that haven't been made yet. We'll settle that in the week ahead. It's absolutely the case that outdoors will be prioritised in all of the activities that we look to open up over time.
Do you still think the 5 as a limit, as a threshold, and then 0 is achievable long term, especially for Victorians who are doing the right thing on the most part, getting frustrated that seemingly this cluster at Chadstone, which has spread to Kilmore, yes, there were a couple of mistakes made along the way, but generally speaking, it was all within the rules, and yet we're not going to get there as a result of these clusters?
It's totally frustrating. It's frustrating for Victorians, frustrating for me. But those next thresholds for the next steps are again based on what those steps will allow continued suppression of those numbers to do. If you were to go at 25 cases a day, then you would see it 50 cases, 100 cases, 1,000 cases. We can't do that. But those thresholds are still there as signposts along the way about what it'll enable us to do. And so I think we can get there, and I think we should use those as still as the decision points for the next phase of opening up, as is the case across Australia. We haven't got 100,000 people in a stadium, even in places that have had no virus, for that similar reason, that a single case would kick it all off again. And so there will be a constraint, there will be limitations on this that are in line with the numbers that we see in Victoria and across the region.
Premier, do you think that there should be a point where government determines that this lockdown has been in place for far too long, and you'll start to ease restrictions, not because of, say, case numbers, but say what Minister Foley was talking about, mental health, people getting their businesses open, that sort of thing?
No, you've got to defeat the second wave first. If you don't fix the health problem, then there can be no sustainable, meaningful economic rebuild. That's just a fact. If you try and pretend that this is over when it isn't, then there will be a period when things appear to be quite good. Everyone will be up and about, and they'll be very pleased to be able to do things they've not been able to do for a long time. And those things are very personally valuable to people. I understand that. They're valuable to all of us. But that'll all come crashing down pretty quickly because you didn't do the job properly.
So if there's 14 cases a day for, say, the next 4 weeks, I know we're talking in hypotheticals, but do you continue with this lockdown? I mean,
what you've got to do is you've got to make reassessments every single day about what logical further improvements or achievements you can make. And again, perhaps I misunderstood your question. If what you're saying to me is, or asking me, if the tail of this proves even more stubborn than we thought, will we have to factor that in? Yes, of course we will. Of course. But all the advice to us, and all the experience as well, is that as people moderate their behaviour, you can get the numbers down very low, and you can keep them low. We're not looking for 0 cases every day forever. We're not anything other than, I suppose, resigned to the fact that next year there will be cases, there will be outbreaks, next week, next month. that's not the strategy that we are employing is well known and well founded. But look, all of that will be looked at in fine detail. But the thing about it is, we've had some days this week or over the last week to 10 days where we had single figures. We've had these couple of outbreaks that have been very well handled. But it does speak to the fact that, sadly, time is a really important part of this. And enough time elapsing so that you're confident that you've got a complete picture. It's very, very frustrating, but decisions that we made a week ago, we won't really see, or if we'd have made a decision this week, we won't see the results of that for 2 or 3 weeks to come. Today's not about trying to avoid providing some certainty around a number of things that I think will change next weekend. It's just about flagging with people that I don't think we're going to be able to go as far and as fast as we had hoped, but there will be movement. So people can be confident that this strategy is working, but it's a stubborn thing. It's a terribly stubborn thing. And we're not looking to drive it down to no cases forever, but we've got to get it down to very low levels, particularly mystery cases, in order to be confident that as we open up, we can stay open. It's not really any more complex than that.
I suppose adding to Elias' question is there a point where you recognise that the roadmap, the original roadmap and all its figures, was unrealistic?
No. We have been ahead of schedule for each of the last 3 or 4 weeks. Whether we ultimately finish up by the 18th, the original deadline was a week later, whether we by then can do all the things that we had hoped to do, only time will tell there. We have to wait and see what those numbers are like in the next week, 2 weeks. But there will be substantial changes on Sunday, and they'll be what's safe, they'll be what the data and the science and the doctors tell us we can do without running an unreasonable risk of being pushed back into this. If you'd said to me 6 or 7 weeks ago at 725 cases a day and asked me where I thought we'd be right now, then I could have hoped to be where we are now. But there would have been a lot of international evidence, and just look at Europe, just look at whole parts of Asia, look at the whole of North America. I would have had significant doubts about whether we could get to this point. So we shouldn't in any way underestimate or downplay the work or fail to recognise the work that Victorians have done and the amazing performance we've seen. To get these numbers down into these such low numbers now is a great credit to everybody who's given so much. We've just got a bit more. We've just got to see this through for a little bit longer. But again, there will be announcements next Sunday. I'm just being as open and as frank as I can be in levelling with people that I don't think we'll be able to go quite as far and quite as fast as we had hoped to. That I think is part of the job I have, is to be as frank as I can be.
Randy, you spoke about chance, and I know you don't want to take a gamble when lives and livelihoods are on the line.
No.
But what does the modelling say about opening up at sub 10 cases like we currently have? What is the chance of it ticking up if we were to move with the full, because obviously step 3 was going to be the most substantial one so far. So there is a lot on the line for this next.
And what I'm really talking about today is that the notion of that being split. So it might be a number of steps rather than one big step. So, but it still will be movement forward. There still will be steps that we take because we think that will be safe. Whether all of what we had hoped to do is safe, that's looking less likely. But again, we have to see how these numbers run throughout the week. I'm just trying to be as clear as I can be. But look, all those risks, all the risks that the original modelling indicated, I haven't got that document in front of me, but all the risks were then essentially reconfirmed when we reran the modelling, having taken out some assumptions and put data in, like as the weeks passed. There's still a very significant risk if we were to open today at these sorts of numbers, then we run a very significant risk that we can't contain this. And that is to say, when I say we, all of us, not as a criticism or a commentary on public health response. It's stronger than it's ever been. But there'll be very, very few jurisdictions in the world, in fact none I think, with the underlying mystery cases that we've had and have, the case numbers we've had and have active now, it would be a very big gamble. But the good news though is a week, 2 weeks, 3 weeks. As these weeks unfold, that risk comes well down, and you get a very significant return for having been as stubborn as this virus is. You get a really significant return, because we're not talking about being open for a short period of time. We're talking about staying the course and then being able to open up and stay open with a very, very different 2021 to the difficulties and the great sadnesses and tragedies of 2020.
Premier, will you release the inquiry's report on the same day as you receive it?
I believe so, yes.
So even if it is released ahead of November 6th, it'll come out that same time that you receive it?
Yes, we wouldn't necessarily commit to responding to it that same day. We'd want to read it and go through it, but this is a public process. It should be a public document, so I've got no problem with that. On the issue of whether it's on the 6th or earlier, I've certainly got no advice that it'll be earlier. It could be. That's ultimately a matter for the board. If they get their work done quicker, then that'd be a matter for them. I certainly hope that the opposite doesn't apply. We want the report as soon as it's done, but it has to be done properly, and they have been through they've done a lot of work, looked at a lot of things, and I have no reason to believe that they're behind. I think that the 6th of November, if we're correct in that date, certainly that first week of November, that's when the report's due.
We're up to 100 of these briefings now, Premier. How many more do you reckon we'll be doing?
Well, Noel, the only numbers I'm focused on are case numbers, and getting them as low as possible, and then taking safe and steady steps and keeping them low. They're the only numbers that I am focused on.
Premier, can
I have said a few times, though, I don't ask people to work harder than I do. I just won't. I haven't done that for 25 years, and I'm not about to start doing that now. Nick.
Premier, on the missing 6 minutes with Graham Ashton, I just wanted to get something on the record. Did you receive a text from him during that period?
No, I did not.
Did you send him a text back?
No. I don't speak to the Chief Commissioner very often at all, and I certainly didn't speak to him then, or about these matters.
And have you asked anyone in your office whether they had?
I'm not going to be... again, you've asked me a question, and I'm uniquely placed to answer that question. The inquiry, I'm not going to cut across the work that they are doing or might do. Again, if you look at the evidence, if you look at the fact that it would seem to me that Mr Ashton's understandings of what was and what wasn't happening evolved throughout that entire afternoon. I've made statements, I have provided sworn evidence, I stand by that evidence, it speaks for itself, and I'm really not interested in trying to pull apart these matters any further when at exactly that time, this time, right now, there's an independent process that's doing exactly that work. If they need anything from me or anyone in the government, they only need to ask. Each time they've asked so far, the answer has been yes. Whether it be a budget increase, more time, they did ask for more time and they were given more time. They were, of course, originally, they would have already reported by now, I think. Actually, well and truly would have already reported by now, but they needed more time. So people are being nothing but cooperative and nothing but accurate, because that's what an independent inquiry like this is all about.
Brett, I've just been sent some of the testing guidelines for Box Hill Hospital, that outbreak there. It appears that people who don't necessarily work on the infected ward, but just visited there on the day, but didn't spend more than 30 minutes there, aren't required to be tested urgently. I mean, obviously we want everyone to get tested, but why is that 30 minutes? Why not just test everyone that was there right here and now?
Oh, it's just about having a proportionate response to an outbreak. Again, you know, the likelihood that anyone's picked something up not having worked directly on that COVID ward. You know, these are outbreak guidelines have been worked through based on national guidelines, based on very close work with the Health Services Pandemic Leadership Team, Safe Care Victoria and others. So it's really trying to get that balance. But, you know, there'll be a very clear understanding that anyone who's symptomatic isolates immediately, gets tested immediately, and for all of those who have direct care or who are above that 30-minute threshold would get tested.
So you're not concerned about the risk, I suppose, for those specific staff members, even though, you know, we are so close to getting to this next step, we could just snuff it out by just testing everyone, get it back in 24 hours?
Look, I'm happy to look into it. I'd like to be able to check exactly what that approach is before I come back for comment, because I haven't seen, you know, what the plans are.
There is also reports out of Box Hill Hospital, I think it comes via the nurses union, that only certain people were given the appropriate PPE, the N95. Does that concern you?
I don't know if that's the case. I know that there are claims that staff acquired their own PPE. I think it's absolutely right for the employer to say whatever PPE you have should be TGA approved and should be of a standard that appropriately protects you. They've got the OC health and safety obligations to uphold, so they need to make sure that their staff have all the appropriate personal protective equipment.
Any other issues? Just a very important final message. If you have any symptoms whatsoever, please don't wait till Monday. Please go and get a test today. We'll get you your result tomorrow, and we'll stop you from potentially infecting other people as soon as possible. And that's how we'll drive these numbers down low. If there's no other issues, thank you. We'll see you tomorrow.